Good evening once more.
Thank you.
I'm glad you are still present here today again. We'll just go ahead to start. Once again, you are welcome to this second episode of LabTalk, which is titled Understanding the Quality Management System. You just kindly give us the honor to introduce yourself again, introduce yourself to us. You have a great portfolio. I believe you're in a better position to do that. Tell us, who is Dr. Keunmoe Philomene? Give us all the details about your professional journey and your career.
I want to start by saying that it's a pleasure for me to join you today, take part in this talk on quality management system. As a laboratory professional, it is really important always to talk about what we do behind the scene every day because it has a significant impact on the diagnosis and treatment of the patient, that is improving their health care. I am Dr. Keunmoe. I am a biomedical scientist and a lecturer in the University of Douala. It's over 20 years now that I've been accompanying the population, the diagnosis of their ailments. I'm very happy to be with you people this evening.
Thank you very much for joining us. It's a great pleasure. Tell us about your experience at UNI LABO. How has it been?
My experience, I will not even say it's a challenge that we normally face every day with specimen, with patients. The experience so far has been very great because every day we deal with what we are going to call the quality management system because we have experienced that without it, the quality is not there. Every day we fight against non-conformity about writing or looking at causes of maybe non-conformity and trying to write strategy so as to improve the quality of our result. That is our daily fight.
You touch a lot of life, especially in the city of Douala. Let's just dive
Yeah,
into this. Thank you. Let's dive into this topic, which is on understanding the quality management system. The quality management system is something that I don't think is known by every medical laboratory professional. It's true that most professionals do not master it. They don't actually know the ins and out of the quality management system. So I want you to tell us more about this quality management system that you implement at your own laboratory at UNI LABO. Tell us
okay.
about the quality management system. What is it all about?
Thank you very much for that question. What I used to say, I will still say it. Quality management system, as I used to tell my students and my staff, is just a kind of secret ingredient that we put in to do it well. It is that secret ingredient that you put there to be able to do can now set her apart from others. We can say that the quality management system scientifically is a set of policies, it's a set of procedures, it's a set of, let's say, it is a set of processes that an organization puts in place to ensure that product or the service or the patient in case of laboratory have a quality result. That is the quality meet up with the need of the service of the patient, of those using the service, and even go beyond their expectation. With this, you will see that they can go and come back often on. That's what quality system is all about.
Thank you very much for the elaborate answer on the quality management system. These are the policies that each management of a laboratory put in place to ensure that patients receive the best quality of service when they come to the laboratory. Thank you very much. It has a lot of facets. Tell us more about what are those various components, what are those things that build up to form the quality management system? What are those components?
If I got it right.
They are the components of the quality management system.
The components of the quality we have, as I said, they are about 12. The number,
Yeah.
you have first of all the organization, you have the process control, you have safety and facility, you have the equipment management, you have documentation, you have I don't know what else, you have process improvement, you have back there 12.
Those pillars are very essential to ensure that this patient receive the best quality of services. Talking about this quality management system, what are some challenges that most laboratory face when it comes to implementing this quality management system in their laboratories?
Doctor, thank you very much for that question. I think the challenge is more about looking at the way people work in the lab. And I used to say the first one is the lack of commitment from the leadership, that's from the director of the laboratory, because he's the one that drives the quality management system.
Exactly.
If he cannot drive it, then it's going to have an implication on the staff, on all the laboratory, in fact.
So true.
Because we can see that the director or the leader of the laboratory is who carries the laboratory ahead. He's going to allocate tasks, he's going to appoint a quality management officer. If it is not there, all those things will be affected. He's the one to try and give out time to teach, to train the personnel. Also, not only training the personnel, allocate resources because we need money to buy the good equipment and also the material even for quality control because all here is about controlling what we are doing so as we issue out good results. We also have what we are going to call limited understanding of the PMS.
Exactly.
Some people find it very, how do I say, the concept is very difficult for some people. So it is just the way of getting used to it or the way of tackling it because what, as I used to say, the quality management system, according to the ISO that we have, is divided into two main parts. We have the management the management requirement that entails that is the documentation, the audit, and the organization. We also have the technical requirement that entails personnel, testing, SOPs, and quality control. If we can abort it in such a way, I don't think the concept will be difficult because we have limited understanding of that quality control system. I think it's one important part of it. And we also have resistance to change because in our own
So true.
does its own thing. So when you want to tell somebody that let us do it this way, they will just try and tell you that no, we used to do it this way. So with the present concept of evolution, we are talking of system thinking. When we talk of system thinking, we are talking about changing, going globally into a concept, narrow it down even to make it where we can easily touch, where we can easily evaluate. Many people, if we start in this, we continue to keeping in that resistance to change, it is difficult for laboratory to be up to the task. It will be difficult even for laboratory to get accreditation because when you get an accreditation, at least it is telling us that another important thing is competency. If you look at the ISO 2012, it was really talking about it is the leader of the laboratory that has to train. That manual is even talking about how you are going. That is, those are challenges that we also have poor documentation. Most of the time when you go to the lab, just for other to come, you have to show that you have been doing something. For you to show it, it has to be written. I was talking about poor documentation practice that usually in the laboratory there may be non-occurrence of events or strategy is not even put in place, there is no record, you just pass it, especially in laboratory where there is no quality management system. See those things occurring on and off. We were also talking about weak quality culture. The weak quality culture will come when you have to shift blame on a kind of staff who has done something wrong. So with quality management system, you have to, when there is a non-conformity, you have to look for the root cause analysis is instead of shifting blame on others. From that, you people can look for the root cause analysis and find corrective measures so that such non-conformity will not occur again. If not, the staff is going to be afraid. They are going to be afraid. Anytime they commit anything, they will be hiding it. That will affect the work. Meanwhile, if there was something wrong that they carried on or a mistake that they did, and you came and start asking questions, why, what happened, why, without shifting the blame on any of the staff, there will be a kind of brainstorming. Everybody is going to think. It is still those staff that often bring the, 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 the strategy to solve this problem. Brains are put together. Together we can find a strategy to solve the problem so that next time it doesn't occur again. At the same time, design somebody to follow up the strategy even for some time to make sure that it is being done. If not, the quality culture is very dangerous in the laboratory. These are something that we have to really look into. Then we also have lack of data. Many laboratories generate data. They don't use it. Maybe they don't know how to use it. That's how I have to do it. Because in the quality management system, if there was a quality management system there, they will know how to manage this data. I'm taking, for instance, if you are working in a chemistry, clinical chemistry, for instance, you have quality control data. And those quality control data, at times they are outside range. You see in a laboratory where there is non-conformity, you will find out that at times they are not just even, they are not even serious looking into that value. Meanwhile, if there was a quality control management there, that value you will stop the work. The quality control is asking you to stop that work and check what is wrong. Is there a random error or a systematic error? With that, you can now correct. Is it the instrument? Is it the pipetting? Is it the reagent? Is it the fridge where you were storing? You start looking at that's the thinking system. You start looking where is the problem. At the end of the day, you may identify one or two elements that contributed to the wrong result. So I want to say there is difficulty also to implement the standards. Laboratories find it difficult, very difficult to implement this standard. What I want to say here is just that it's true that the document is complex. I think it's a step-by-step procedure.
Amazing. You have mentioned quite a lot of points which are very, very, very important when it comes to challenges. You mentioned a point on leadership, which is to me is a major pillar to the resistance of the implementation of the quality in the laboratory. Because when the leadership is not committed to implement the quality management system, the other staff that are not going to follow suit. Getting the management and the leadership to understand the importance of this quality management in the laboratory is very, very important, because they are going to pull the others. They'll pull the others to work towards achieving a quality system. Thank you very much for that. Thank you. Now, a follow-up question to that. I will ask, where do laboratories really start when it comes to the implementation of the quality management system? Where do they start from?
When it comes for as I say, I started with lack of commitment of the director. We should start from there. There should be full commitment of the leader of the laboratory, because he's the one he's the one to drive the quality management system. If the leader does not really know about this, it will be difficult for the laboratory to implement that quality management system. That's why as I said last time, I normally call upon leaders of laboratory to really go on to read these courses, to do these courses on quality management system and quality control. because it is very important for them to know it. They are the ones to carry the laboratory ahead if they want to embed that quality management into their system. It is very important. Know that science is really growing very fast. Very soon, I think it's one of the things that will be compulsory for laboratory to really put on to be sure that they are doing it. It is not saying that they are not doing well. This thing is coming to tell outside that the result coming from this laboratory are good one because quality is there. The next thing is to understand the framework of the standards. That's guideline. You have to understand it. That is what I just said because it is still this leader that have to understand this framework of the quality control standards. The one that laboratory normally use is the ISO 15189. That's what concern laboratory. They have to understand it so that it can be easy for them when they want to implement. It is sure that it's complex. There is a way to go about it, as we said. Another thing is the next thing is really you can start it at any time. That's what I used to say. It's not that you go and start to close the laboratory. No, you can start assessing your laboratory. First thing, you assess what is there, you correct them. When you assess it, you ask yourself some questions. There are some questions that when you are assessing, you need to ask yourself, am I regularly doing my quality control? Or what happens when there's non-conformity in my laboratory? How do I handle non-conformity? Or do I really verify my results before or review the results before releasing them? There are a lot of questions that you have to ask yourself so that you start answering them. You start from there. That's where you pinpoint the point. When you have answered those questions now, it is giving you an idea of where to start. You start with the essential. You can start even to write SOP on blood collection. Anything very simple. You start writing your SOP on them, procedure, you write SOP. You have to stress, as I used to say, if you are a beginner, you have to stress on the quality control. You have to be sure that your result is accurate, is precise. You go and invest on control management. Check your control, review your control, record them every day. No matter where you are working, somebody was telling me that can we do on control on toxoplasma? Toxoplasma have value, it's quantitative. We can pick the control whenever applicable to check if the result is accurate. There's a way to check about it. The Levigen chart that we talk about, apply it in chemistry, we also apply it elsewhere. It is very important that after that, you now focus on the quality of the work that you're bringing out while organizing your document. While doing so, you start organizing the documentation. You can now put it version one document talking of this date, you put the date. When there is an old one, when it is finished, you archive it. That is very important. You train your staff. It's very important. You train them for competency. That's all what it's all about. Because if staff are not competent, still, no matter what you do, you will not have good results. You train your staff, you train them yourself. As I said earlier, in the quality manual, you will have a section that will tell you how to train, how to evaluate them. You set a time, maybe after training them for a particular test, you can now come and review after maybe a week. If they are doing well, you continue assessing them until you find that it is found out that they are doing well on their own before you come. Then you have to come from time to time to review if the work is still going on smoothly. Then another thing I wanted to say is that when this is done, you can introduce a simple, how do they call it, monitoring system. As I said, you should be monitoring how the test is being done. So the important thing is to be able to track them when there's any non-conformity. Are you able to track the non-conformity? So this book is really telling us on example how to track them. For instance, maybe some tests are consistent. When is this result of issue? You start recording it at the end of the day. To find out the turnaround time within a month. You say, oh, maybe it's to do it as fast as possible. The case is not urgent. Now set out, say, for the next month, yourself that, okay, we have sample rejected, label or stabilize or clot or any other thing. You count the number of samples that is rejected within a week or within a month, how they are doing with it. We are going to see that there will be significant reduction in the sample.
Thank you. You have really given I would say, a step-by-step process how to begin to implement your quality management system in your laboratory. First, introduce the leadership to what quality management system is all about. You begin with an assessment, a baseline assessment of where your laboratory found itself, so that from there you can take off to the better horizon. Thank you very much for that. At this point, we have exhausted all the questions that we had. I want you to give a message, one message for a laboratory professional and one message for a director when it comes to the quality management system. What is the message that you can give to them?
I think from what I have said, if the auditor has gotten what I have said, what I have to tell them is that they have that say what you do what you say, prove it, say what you do what you say, prove it, improve in it. Is it clear?
Yeah.
If not documented, then nothing happens.
Exactly.
That's all what I can say.
Exactly. What is not documented is not done. That's
Yeah,
that's a little code in the laboratory, because if you can't prove it,
yeah,
what really shows that you did what you are saying that you did? Thank you very, very much.
that.
A message for a junior professional who is just coming up in the field. What would be a message that you give to them?
As I said earlier, even to the elder, to the colleague, what I can advise them is that they should register for this course. I think they will grow with the quality management system because they
Exactly.
are opportune to have this course along. I will urgently ask them to join this course and learn more about this quality management system because in our program, that is in their syllabus, they will rarely come across such program. They will agree with me. For some of them who have already been trained, most of them will tell you that they have not come across such program.
Yeah,
I
exactly.
think it's time for them to join this course and improve their skill on quality management system.
The course on clinical laboratory leadership and management has been an amazing program. I won't lie. It has been an amazing program. The first time I came across the program, I just knew that I had to take this program because just going through the website, I just saw what they had to offer. I realized that we haven't done that. We haven't done that in our syllabus here in the country. It was an opportunity for me to actually grow in the domain of laboratory, be it the quality management system, being how to lead people in the laboratory. I just could not miss this opportunity. Just like you said, you are advising young professionals to join the program immediately so that they can get in contact with this rare knowledge that is available to them. Thank you very much for attending this session with us at LabTalk. It's really a
Then
pleasure. We hope to have you in
it
the
was a good
next
pleasure.
subsequent session, definitely.
Thank you too, Mr. President. You're welcome. I really appreciate what you are doing because that's going to help a lot of fellow colleagues.
Thank you. Thank you
Thank
very
you.
much.